Guys, welcome back to my channel, Everything Lisa Gaga. Today's topic is trauma. What is trauma? Trauma refers to a psychological and emotional response to an event or series of events that are deeply distressing or disturbing, often exceeding a person's ability to cope with the experience. It can result from various situations, and its effects can be long-lasting if not properly addressed. Examples of trauma. Number 1, physical trauma. This includes injuries caused by accidents, violence, or other forms of physical harm. Number 2, emotional trauma. Emotional abuse, neglect, or witnessing traumatic events can lead to emotional trauma. Number 3, psychological trauma. This may result from experiences like war, natural disasters, or other life-threatening situations. Number 4, childhood trauma. Abuse, neglect, or dysfunctional family environments during childhood can lead to lasting trauma. Number 5, sexual trauma. This encompasses sexual assault, rape, or any unwanted sexual experience. Number 6, medical trauma. Trauma resulting from serious medical procedures, surgeries, or chronic illness. Causes of trauma. Number 1, accidents and disasters. Car accidents, natural disasters like fire and others. Number 2, abuse and violence. Physical, emotional, sexual abuse, or domestic violence and others. Number 3, loss and grief. The death of a loved one, miscarriage, separation, and others. Number 4, war and conflict. Combat experiences and exposure to violence in war zones. Number 5, serious illness or injury. Chronic illness, severe injuries, or life-threatening medical conditions. Number 6, childhood adversity. Dysfunctional families, neglect, or abuse during childhood. Effects of trauma. The effects of trauma can vary from one person to another, but common consequences may include: Number 1, post-traumatic stress disorder, which is commonly known as PTSD. Re-experiencing the trauma through flashbacks or nightmares. Number 2, anxiety and depression. Persistent feelings of fear, sadness. Number 3, avoidance. Avoiding places, people, or situations that remind them of the trauma. Number 4, emotional numbing. Feeling detached, emotionally numbed, or disconnected from others. Number 5, self-destructive behavior, like engaging in substance abuse, self-harm, or risky behaviors. Number 6, relationship difficulties, struggling to trust or form close relationships. Number 7, physical symptoms like chronic pain, headaches, or other unexpected physical issues. Number 8, flashbacks and nightmares, reliving the traumatic events in dreams or waking thoughts. Solutions of trauma. These include: Number 1, professional help. Seek support from a mental health professional experienced in trauma therapy. Number 2, supportive relationships. Build a supportive network with understanding and empathetic friends or family members. Number 3, self-care. Engage in activities that promote relaxation, such as exercises, mindfulness, and hobbies. Number 4, expression. Encourage open expression of emotions and feelings through journaling, art, or talking to trusted individuals. Number 5, medication. In some cases, medication may be prescribed to manage symptoms like depression or anxiety. Number 6, avoid triggers. While healing, avoid triggers that may intensify symptoms or re-traumatize you. Number 7, patience and time. Healing from trauma takes time, so be patient with yourself during the recovery process. Remember that the effects of trauma are significant, and seeking professional help is crucial for proper healing and recovery. If you or somebody you know is experiencing trauma-related difficulties, reaching out for support is essential. Thank you so much. See you next time. Bye-bye.